Hi everyone, my name is Jerry Richards and I've done my project on type 1 diabetes mellitus. Type 1 diabetes, which I'll refer to as T1D, constitutes roughly 5 to 10% of all diabetes cases, while the other 90 to 95% is type 2 diabetes. This is an autoimmune chronic condition characterized by a lack of insulin or inability to produce insulin altogether due to the body attacking its own insulin-producing beta cells within the pancreas. This creates a significant problem with macronutrient metabolism. It's often been referred to as juvenile onset diabetes. However, it can really present itself at any age. Etiology is multifactorial. Environmental exposures have been linked, such as viruses including Group B, Coxsackie, enterovirus, rubella, mumps, and Epstein virus. Another environmental exposure would be toxins. There's also a genetic component. For individuals in the general population, there's a 1 in 300 people risk. For individuals who have a family member with T1D, that risk increases to 1 in 20 people. And for identical twins, the risk is 25 to 50% increased. So TrialNet is a large international network of T1D researchers that aim to prevent progression of disease. And they explain that disease progression of T1D occurs in 3 stages. The first being immune system under attack, positive results for 2 or more T1D autoantibodies. However, no symptoms have presented themselves. Step 2 would be a more progressed stage with increased loss of beta cells, abnormal blood sugar levels, but still asymptomatic. And then stage 3 is characterized as clinical diagnosis, where diabetes-related autoantibodies are present, abnormal blood sugar levels, and the presentation of T1D symptoms due to significant loss of beta cells. So, pathology and mechanisms of disease. Once the autoimmune process has begun, pancreatic beta cells are the main target, and over time, 80 to 90% of total beta cells will be destroyed. This results in scarring of the pancreas and atrophy of acinar cells, which are responsible for producing enzymes to aid in the digestion of food. Alpha cells of the pancreas are also affected by T1D, resulting in an increase of glucagon levels. Glucagon plays a balancing act with insulin to regulate blood sugar levels within the human body. When glucagon levels are elevated concurrently with beta cell destruction, hyperketonemia and hyperglycemia occur as insulin is not present to bring blood glucose levels to normal range. Fat oxidation takes place due to the unregulated mobilization of fats for energy, resulting in an undesirable level of keto bodies and acid in the blood, or ketoacidosis. 2 pathways of beta cell apoptosis. The first is an extrinsic pathway, where receptor mediated, and it's involving T lymphocytes. And then the second pathway is intrinsic, which is mitochondria driven and involves B lymphocytes. Clinical manifestations of T1D present themselves as a result of beta cell destruction, inadequate nutrient metabolism, hyperketonemia or excess ketones circulating throughout the blood, and hyperglycemia, which is caused by excessive blood glucose and insufficient insulin to allow for uptake by the body's tissues for energy use. The most prominent symptoms are polyuria, or excessive urination, polydipsia, or excessive thirst, and dry mouth, polyphagia, or excessive hunger and unexplained weight loss, blurred vision, glucosuria, or high concentration of glucose in the blood, and fatigue. These are all more common signs of diabetes in type 1. Some cases have an initial presentation of diabetic ketoacidosis, which is a life-threatening condition that causes confusion, stomach pain, dry, flushed skin, debilitated breathing, nausea, vomiting, and a fruity breath. Prognosis for T1D is pretty good considering adequate health care. If left untreated or poorly regulated, T1D can lead to depression, nerve damage, and foot problems from diabetic neuropathy, sleep apnea, vision loss, kidney disease, increased incidence of infection, stroke, gum disease, and heart disease. Type 1 diabetes and type 2 diabetes present themselves in similar ways, such as polyuria, polyphagia, and polydipsia, in addition to weight loss and fatigue. However, with type 1 diabetes, a random blood glucose level above 200 millimoles per liter is observed, in addition to specific autoantibody testing measuring for glutamic acid decarboxylase. As mentioned earlier, the risk of developing type 1 diabetes has been associated with environmental exposures, viruses, and toxins. One specific virus that's been clearly linked to T1D is Epstein-Barr virus. And theories of the Epstein-Barr virus contribution to pathogenesis of T1D include EBV, or Epstein-Barr virus, infection causing a release of cytokines leading to enhancement of cytotoxicity in immune cells. Second being EBV damaging beta cells by spreading to pancreatic tissue throughout the circulation of infected B cells. And then the third theory being that EBV may trigger molecular mimicry of viral antigens and host proteins, exacerbating the autoimmune inflammatory response. T1D has also been linked to coexisting health conditions, one being celiac disease and the second being depression. With celiac disease, it's been said that there's an increased risk of 1.4% to 19.7% of celiac disease development in individuals with T1D. Environmental factors, immunological factors, and genetics play a role. The genetic component of human leukocyte antigens, HLA, specifically the HLA-DR3DQ2, has been observed as the link between celiac and T1D. With depression, the CDC reports an increased risk of 2 to 3 times more experiencing depression for individuals with T1D. This may be due to the feeling of aloneness or the effects of hypoglycemia, hyperglycemia, and just being different from everyone else. In addition to the slides I provided, I decided to include a YouTube video created by the Phoenix Children's Hospital, which I thought just gave a really great rundown of type 1 diabetes and explained things in a little bit more depth. So, yeah, and then my references are here. If you have any questions, please contact me through our school's platform, and I'd be happy to answer them. Thank you.